Bismillahirrahmanirrahim. Uh, this topic is not from the textbook of medicine. For me, this is the medicine. Bedside encounter between a patient and a physician is the central to the practice of medicine. Communication with the patient, history taking, performing a physical examination is not only a source of trust, healing, and satisfaction for the patient, but it is also a great source of satisfaction for the physician as well, what he is dealing with in that patient. Just one slide is missing, I don't know where that has gone. As the Generation X physicians, what we think that this art of performing a physical examination and dealing with the patient is somehow fading away in the Generation Z doctors. Sir Bikaram, Professor Rubina, Sir Rizwan, wide open eyes, keen observing eyes, a soft, gentle touch with warm hands, and a smooth transition from palpation to auscultation, and paying a meticulous, getting the examination of skins, ear, nails, and mucous membrane, and paying attention to all trivial things, proceeding to the systemic examination. And while getting this information, all these senses, hands and eyes and ears and nose, directly connected to the cerebral cortex, and this information of the physical examination relating with the already taken history, and a complex thought process in the cerebral cortex of a physician, what are the possibilities? And by the time we finish the examination, we have a plausible list of possible diagnoses in the patient. And more than that, we have a way forward for further evaluation, investigations, and management plan. Sir, Azizur Rahman sir, sir, this is how the Generation X physicians were. And somehow, while we act as examiners, most of the time we discuss together that this art of medicine is somehow fading away in the Generation Z physicians. So this situation is compounded by the technological advances. The technological advances competing with the time which physicians must be spending with the patient. You look during the rounds, most of the time when we move from one patient, we are actually moving from record of the one patient to the record of the other patient, and we are looking at the files, imaging and labs and results and biochemistries and whatnot. So from one file to the other, and just patient is looking at us, and just little touch of palpation and a little touch of a stethoscope. This is how the examination now performed, and just most of the time it is with the files and it with the digital records of the patient. It is with the echoes and endos and imaging and whatnot. So we are finding some diagnostic label for the patient out of those records, and just we want to label that patient is suffering from advanced retinopathy or monkeypox or whatever it is. So from those files, we are labeling the patient. This is the diagnostic label for the patient. And the attention which that patient needs is somehow we are walking away from that. And these technological advances, at the same time, competing with the clinical skills, and I fear that my clinical skills may be devalued and are likely to atrophy in the future. So a brief history of physical examination. The Leopold Arnberger, 1761. This was the dawn of modern physical examination when he first described the technique of percussion. While in the memory of his father, who used to tap the casks of wines to establish how much wine is left. And then in 1808, René Laennec, he rolled a piece of paper into a cone and a point of that cone into ear and base to the chest of the patient, and then he developed the first stethoscope. Hermann von Helmholtz invented the ophthalmoscope in 1850, 1861. This was the Carl August Wunderlich who described the human body temperature and its pattern in different diseases. And then in 1875, Wilhelm Heinrich Ebb and Carl Friedrich Otto Westphal used the hammer to test the deep tendon reflexes, and Riva-Rossi in 1896 invented the sphygmomanometer. So in the 19th century, all the instruments which were used to take the vital signs, so as we know these are vital signs today, these instruments were complete. And then in the 20th century, it was the apex of clinical medicine and physical science. Heart murmurs, deep tendon reflexes, blood pressures, retinal vasculature, these are those things which are present in the human body, but other than doctors, nobody was able to see at that time. So it was the privilege of the doctors who were seeing all these things at that time. Then, in the latter part of the 20th century, these were the textbooks which were solely focused on the art of physical examination. These were published. Hutchison is still taught in the medical schools. And then MacLeod in 1964. And in the preface, we are convinced of the need to acquire and hone clinical examination skills to avoid unnecessary, expensive, potentially harmful our investigations. In 1961, if we compare today's medicine with that time, कितनी एक harmful और our investigations available थी या हो जाती होंगी, if we compare it with today's sort of things. So if we are not doing it, it means patient is vulnerable with number of things, and we will be shooting in the dark, ordering this, ordering this, ordering this, ordering this, without touching the patient, without listening the patient, without doing a thorough and meticulous clinical examination. So, core bedside skill, history taking and physical examination. Dr. Rubina, Professor Rubina is sitting here. This is the art of medicine which we are doing still for diagnostic accuracy and patient-focused care. This is what we need, a detailed history and physical examination of the patient. But technological advances are competing, as I already said, and sometimes these are better and more accurate than what we do with our hands and all those things. Look at the Sir Azizur Rahman, third and fourth heart sound, and splitting and reverse splitting of the second heart sound, and pre-systolic accentuation of a diastolic murmur and opening snaps, and changes in intensity of murmur with inspiration. This is what you taught. This is what we were at that time. But are these skills just an echocardiography probe is perhaps much better, and this stethoscope, which is my honor, which is once my pride, is sometimes a very humble in front of these advances, technological advances. Look at this pulse oximeter. Patient brings this pulse oximeter with him. Every third-year student has this. And the information, which is in this a little bit 500, 600 rupees instrument, we cannot perhaps get with all our physical abilities. And then, just at the art of percussion of the liver, number of students we fail in part 2 examination because they don't know how to percuss or how to palpate the liver most of the time. But look at the precision of an ultrasound, bedside ultrasound. Just put a probe, and it is just not the size and echostructure and fatty infiltration and hemangiomas and small SOLs and stiffness of the liver. This probe putting over there just gives us the diagnosis in that patient. So whatever we are estimating with the excellence of our clinical skills, it is just replaced by a probe of this ultrasound, bedside ultrasound. And a bedside cardiac monitor, what does it not do? Everything almost. So we even don't need to go near to the patient, and its blood pressure and pulse and everything is there. So in the excellence, this excellence of skills in clinical examination, once my pride, no more needed in this era of technology. This is very sad for me. But look at the inventions of 18th and 17th century. Printing press, steam engine. This is long gone away. with those engineers, with those people who had expertise with these things, workers, everything is gone of 18th and 19th century. And this is replaced by something like this. And these humble instruments of 18th and 19th century are very dear to me, but this may be a near future death of this endoscope, which is my pride, which is my recognition. There may be a death of stethoscope. So this will be replaced by something like this. I am losing the battle. I know it. I know that my skills will be replaced by technology and future. No need of stethoscope, no need of mercury-containing sphygmomanometers, and no need of tendon hammers. Technology will do it much better than me. And soon, perhaps, there will be the funeral of clinical examination. But as a Generation X physician, Sir Azizur Rahman sir, we, as technology is taking away this passion from us, I want to hold the hand of my patient, feeling the pulse, doing the palpation and auscultation. This ritual is part of my soul, and it is the bond between me and my patient. Our grandsons will be cutting jokes by looking at these instruments, which we had nowadays. हमारे grandfathers जो है ना इन चीज़ों से patient को देखा करते थे. They will be cutting jokes, but still, these were the ties. My fear is that the capture of my clinical skills by the technology is beginning, and my replacement as a doctor by AI will be the end of it. And this is not a news now, full AI hospital working over there. And if look at the PSIM of 2021, this is the, Dr. Aftab Mohsen is not here, but this is not Dr. Aftab Mohsen. And this is not Dr. Tariq Wasim. So this will be the leaders of 21, 25 PSIM. And this is the mentor, JA. This is not Javed Akram Saab. And this will be the PSIM Executive Council. But as Generation X physician, I have witnessed the incredible evolution of medicine, from the primacy of clinical skills to the rise of cutting-edge technologies. I admire all these advances, but deeply concerned what we may be losing. The art of clinical examination is fading away among the Generation Z doctors, overshadowed by an over-reliance on the technology. Today, let's do it. Technology is a powerful ally, we admit it. But it should never replace the foundation skills that define our profession. Let's reignite our collective commitment to the clinical excellence, ensuring that next generation of doctors doesn't just treat screens and reports and medical records. Connect deeply with the patient, trust their hands, trust their ears, uphold the timeless art of bedside medicine, because no machine can replace the power of a skilled physician's touch or confidence it inspires in a patient. कोई machine Dr. Azizur Rahman नहीं बना सकेगी, कोई machine Professor Rizwan नहीं बना सकेगी, और कोई machine Bikaram भी नहीं बना सकेगी. This is what we need to commit to do. Thank you very much.